Good evening. Welcome to ONV as we present a healthy conversation. I am your host, Pat, Nurse Pat, and tonight my guest is Chris Nicolai. He is Community Outreach Director for the American Heart Association. Now, before we get into our discussion, Proverbs 4:23, above all else, guard your heart, for everything you do flows from it. Now, Chris, tell us a little bit about yourself and your role with the American Heart Association.
Absolutely. First of all, thank you so much for inviting the American Heart Association to come and share about our mission and who we are. So my name is Chris Nicolai. I am the Community Impact Director for the American Heart Association, and my role is to really bring the mission to life in the local communities to strive for longer and healthier lives in the community.
Okay, now, although this is the end of February, February is known as Go Red for Women, and it talks about heart disease in women. What would you, as your role in your community outreach, would you say to women that are listening to us tonight?
Absolutely. So, Go Red for Women is one of our biggest movements in the Heart Association. And there's a reason for it. Heart disease still remains the number one killer in the United States. And there's a reason for that. There are so many factors that are playing into our health, whether it's stress or lack of nutrition being provided in the community. There's just so much that plays into it. And the scary thing when it comes to women's health is that over just nearly 50% of all women 21 years or older all have some effect of heart disease. And that's why it's so important to bring awareness when it comes to paying attention to our hearts, paying attention to our bodies, and making sure we're taking the time to take care of ourselves because we owe it to our friends, we owe it to our families, we owe it to our communities to live the fullest potential when it comes to our health.
Now, but prior to us coming on the set, we were talking about blood pressure, and you
Yes.
said that high blood pressure is dominant in the area, or would you want to elaborate on that a little bit for me?
Yeah, absolutely. So, one of the great things that we can do right now to prevent strokes or heart attacks from occurring or surprisingly coming into fruition into our lives is making sure we check our blood pressure as often as possible. Just by checking your numbers, knowing what it means, what it represents, and more importantly, that we're acting upon those numbers can significantly decrease the chances of someone experiencing a stroke or a heart attack, especially when it's too late.
Now, you did also say there are three categories. You said A, one, two, and three with blood pressure. What does that mean to a layperson?
Yeah, absolutely. So, the American Heart Association just published new blood pressure categories for clinics and health organizations and for the communities at large to understand what your numbers mean. So, there are three categories when it comes to blood pressure measurement. The first stage is hypertensive stage 1, which is around 130 on top and around 90 on the bottom. And at this level, this is when the doctors are going to start questioning, are you okay? Or what's going on at home? Just asking some basic level questions, but this is when they're going to encourage you to keep a closer eye on it because at this level, we don't want it to go any further than this. Hypertensive stage 2 is usually around 140 or higher above and 100 or higher from the bottom. This is when medications will start playing into the conversation to act quickly to get your blood pressure under control. So then that way it doesn't elevate any further than that. And then, of course, anything higher than 160 or above, on top, and in the lower bottom number as well. This is hypertensive crisis. And especially if you are experiencing signs like dizziness or pain to the chest, or you're growing numb on the left side of your body, this is when you start calling 911. If you are not showing those signs, but yet your blood pressure is extremely high at that level, this is when you need to consult with your doctor if you haven't already.
Okay, and a little bit more about the American Heart Association. What is it doing in our community? Why is it important to have it in the community?
Absolutely. So, again, in my role, we provide resources into the community by partnering with faith-based organizations in different community centers that provides direct services to the community. So then that way they can be empowered to promote heart health in their operations. And a couple of ways that we do that is hypertension management, making sure that the education resources are being made available and accessible to the community with blood pressure screening. So then that way people can be educated on how to manage their blood pressure right from home, but also be equipped with education on simple steps that they can do right from home to take control over their blood pressure journey.
Now, you said something just now, faith-based organizations.
Yes.
What does that mean? What are you doing to connect with faith-based organizations?
Absolutely. So we partner with a lot of faith-based organizations, mainly because people are gathered there. That's where they gather for worship. That's where they gather to receive assistance, to receive help, especially in their most time of need. And we have identified faith-based organizations as a crucial community partner to help us elevate our efforts and to empower them to serve in that capacity where they are providing interventions, especially for people who are registering high in their blood pressure, getting them connected to local clinics in the area like Matthew 25, Parkview Health. So then that way, those individuals are not left powerless. They are getting connected to resources so we can really save lives together with those organizations.
Now, myself, normally we would have a Grow Red program within my congregation. We didn't do that this year. It was more because of the weather than anything.
Oh, 100. I
Yeah, there
believe
were
that.
some Sundays that we weren't able to get out. So that was mainly why we didn't do it this year. But if I wanted the American Heart Association to come into my congregation, how would I reach out? How would I make that happen?
Yeah, absolutely. So you can contact me through email at Christopher Nicolai at heart.org. Send me an email. Let me know what your church or organization is trying to accomplish when it comes to heart health, whether that's blood screening or educational sessions to provide for your congregation, whatever that may look like. Let's sit down, let's talk about it, and let's see how we can empower your church and your organization to really serve your community in that capacity.
Now, is there a particular age group when you're talking about heart health? Is there a particular age group that we should be concerned about?
I'm glad you asked that question. Definitely seniors. As you know, we get older, and we have to be more attentive to our bodies and making sure that we're listening to it when it comes to measuring our blood pressure, paying attention to our numbers when we go to the doctor's office, just making sure we understand what the doctor is telling us and taking action over it immediately, not waiting for the next appointment. And I would also say in our younger generation, we are definitely seeing high rates of hypertension in our younger people. And there's many factors that are playing into that. I would say two, is social media is a big component to that. We are serving the most anxious generation in our young people, and vaping is dangerous for our young people. And so those two factors alone are playing such a huge contributor to hypertension in our young people.
Now, I understand the social media because, if I'm on my phone or on my computer, iPad, whatever method of, I can sit there for hours and a young person, they don't get up, they don't move.
Right.
But vaping, what is vaping for somebody that doesn't know what vaping is?
Yeah, absolutely. So vaping is those e-cigarettes, the flavored smoking products like the cotton candy, the green apple, those little gadgets that you smoke out of. That's what vaping is. And the scary thing that we need to pay attention to is what's being communicated to our younger people about vaping. The common message that is being shared is that vaping is healthier than the traditional cigarette.
And that's what I was going to ask
Yep.
you. Is vaping supposedly replaces the regular quote cigarette? You don't puff
Right.
anymore.
Right. Yeah. So absolutely not. It is the same as the traditional cigarette because it still has nicotine, still has the chemicals inside to do damage to your body and to increase stress levels. It's still an addictive product.
Now, I didn't think young people could buy that those products.
Mm.
I do know I work in the school system, so I know it's out there.
Yeah.
But, I just didn't think that it should be readily available
I
to young people.
I agree with that. I know our state advocacy team is working with the state government to making sure we're keeping those laws at bay, but also increasing those regulations, especially for our young people and the advertisements that goes into it, that is portraying our younger generation to participate in that.
And I agree with you there because I don't think, and I may be wrong, and if somebody out there correct me if I'm wrong, that there are not cigarette commercials on TV anymore.
That is correct. If there are any, they usually come with a disclaimer that this is a nicotine product and is highly addictive. But what we are seeing in that marketing lens is more and more poster boards being posted in throughout our neighborhood. I mean, you walk down the block, in every convenience store, there are posters, there are marketing flyers about these e-cigarettes that is really eye-catching to our younger generation, which is causing them to buy into that product.
And I think, too, the flavoring
Yes.
has a lot to do with it. I may be wrong, but I do think that because if you went and dating myself, buy a Cools way back, if you went and bought a pack of Cool, you got tobacco taste, and that was it, period.
Yeah, right.
There was no mint flavored or cherry flavored Cool cigarettes. So you're saying they can get different flavors in those things.
Oh, absolutely. And that's how they advertise to the younger generation because it comes now with flavors and flavors that are catchy to the younger generation. It was designed purposely for that. Cotton candy, sour green apple, all the flavors that our young folks love, they cater to that flavors. So then that way the younger generation can adopt into the e-cigarettes.
Now, how can we reach our young people to discourage them from going in that direction? What can we do as a generation to help them, to deter them from going down that path?
Absolutely. The most important thing that I would encourage the whole community, especially working with our younger generation, is to be that support for them. It is not an easy journey for them, and it is a hard habit to break. And so making sure that we come with love and comfort and support and encouragement, saying, we're here for you. We want you to live the absolute best life possible, and that includes your health. And there are resources available, especially in the state of Indiana, with 1-800-QUIT-NOW, where when our younger generation says, yes, we want to quit, yes, we want to live our healthiest life possible, that's where we as a community can come in and say, let's get you connected to that resource. Let's help you.
And so it's that similar to, and like I said, cigarettes, you don't hear them advertised and stuff so much now. But yes, there's still cigarettes out there. There are still people that smoking them because if not, they wouldn't be on the shelves.
Right.
So I know there was smoke-free different programs that you could get involved in to kick the cigarette habit. So you're saying that they can also kick the vaping habit as well?
Yes, absolutely. So 1-800-QUIT-NOW is such a great local resource, and it's free and available for the community, for people who are expressing that they want to quit smoking or vaping.
Okay.
And so that's available 24/7 at their convenience.
Now, what if it's a young person that don't want mom and dad to know that they're vaping? Is it anonymous that they could call the 1-800 number and get assistance without pulling the whole family in if they're not ready for that?
Yeah, so I believe so, because they are very confidential when it comes to helping people in this journey. And there's a reason for that. This journey is not easy. And especially, it's very vulnerable when a person comes and admits that they need to stop. And so we want to respect that space, and we want to respect the individual, and we want to empower them to really make that life-changing moment possible for them.
Good. That's good to know. And if there's a young person out there that needs help, I hope that you're listening, or a parent, if you need to send your kid in the right direction. Absolutely. You have that information out there. And I want to talk a little bit about some risk factors that we can do. What are some of the things that you can do to manage or kind of control heart health from having a heart attack? What are some of the things an individual can do to control their health to prevent them from having a heart attack or a stroke?
Yeah, absolutely. So the American Heart Association just published or has material called Life's Essential 8. It is a scientific-based recipe for longer and healthier lives. It really focuses in on 8 categories when it comes to our life, 4 health factors and 4 health behaviors. I won't go too much into the health factors portion of it. One of it is making sure we're checking our blood pressure as often as possible, not just when we go to the doctor's office, because anything can happen during that time. We could experience some real life difficulties or go through some difficult challenges financially or through family. So making sure that we take the time to measure our blood pressure as often as possible. That's a great way to start. And then as you learn about the numbers, what I really want to highlight is the 4 health behaviors that we can change right now.
Okay.
And so the first area is making sure we're getting our proper sleep. Sleep is important. And hear me when I say that. Making sure we're getting that 7 to 9 hours of sleep, making sure we're spending less time on this, especially during the night. This does contribute to sleep. And so we want to spend as less screen time, making sure we're taking 30 minutes before we go to bed and being strict about our bedtime. If it's 10 o'clock, then by 9:30, we are relaxing, we're settling down, and 10 o'clock, we're in bed ready to go.
That's a hard thing to do.
It is, but it is so important. And the reason why is sleep does not only impact your health, your heart health, but it also impacts your overall body health, because your body needs that rest. It's
But that's the best time to pull out that thing and go on TikTok and see what everybody put there and Instagram and look at all the funny jokes is when the kids are gone to bed and you just lay there for at least a good hour and a half, you
Yeah.
know?
Yeah, I know. I get it. I get it. It's so hard. It is a very hard habit to break. But with more screen time, the more we're paying attention to our phones. And we just touched base on that just earlier about anxiety and increasing in our young people because of how much time they spend on their phones as well. But if we really value sleep and we really want the benefits of sleep, we have got to put that phone away. Turn it off 30 minutes prior to your bedtime. Read a nice light novel as your body relaxes and begins to wind down. And then your body will start adjusting to your sleep, and you'll feel better at the
You
beginning of
just
the
took
day.
away everybody's Facebook and TikTok and Instagram. You just took all that away from them.
I'm sorry. I do it out of the love of my heart because I love you. I care for you. And believe me, this is a habit that I'm trying to break personally. It does help. It does help you.
Now, what are some of the things that we cannot control when it comes to heart health?
Absolutely. So, as you get your older, your body's going to adjust according to the current habits that you have, and maybe they're not as great of habits. And there's going to be times where if we are consistent with those bad habits, medication is going to come in to play to make sure that the body is receiving what it needs to.
Now, you mean I have to take that pill every day?
Oh, yes, it's important. Listen to your doctors. Listen to your doctors.
But if I take it on Monday, I should be able to skip it. I'm busy. Can I just come back and take it on Wednesday or Friday?
Oh, no, 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 no. Listen, your doctors are there to help you and to make sure that you are living your fullest, healthiest potential.
Well, when I go to the doctor, I tell him I'm taking it.
Well, and that's a good point. Your doctor only knows what you tell him
Yeah.
or her, and you got to be honest. You got to be honest because if we're not, we're just hiding the inevitable, which could be a stroke, which could be a heart attack. And do we really want to put our families through that type of experience? We owe it to ourselves. We owe it to our families. We owe it to our communities to live our healthiest potential possible. And so,
And I do, being a nurse and being for the number of years I've been in the medical field. I tell when they haven't been taking it, when they come in. So, and but it is, and as he said, it's very important to take your medication as prescribed
absolutely.
and pick a time. Try and take it at the same time every day. If it's the first thing in the morning, if it's better to line it up when you get up and go into the kitchen to get that glass of water or to pack your lunch or whatever you're doing in there, if that's easier to remember to take it, that every other day does not work.
That's right.
No, it really does not work. And only taking it when a week, start taking it a week before you go to the doctor because you figure it'll bring it back down and the doctor won't know, that doesn't work either. So it is important to take your medication. And some of the things that I did do some research on that you can't change is your age, your gender, hereditary factors, your race, or if you've had a previous stroke or heart attack. Those things you can't change, but your everyday life you can change. You can change. And when we were talking about the young people, something came across my mind earlier today in schools, and I don't know if it's everywhere, but they don't have PE as
Mm,
often as they used to.
mm.
Dating myself when I was in school. Yes, I still remember when I was in school, in case my son is listening. Uh, we had to go outside.
Yeah. Outside is good.
We had to run and play and do all that stuff that kids don't do anymore.
You know, it's interesting you bring that to, just by walking 30 minutes a day, 5 days a week can significantly improve your blood pressure. Just going for a walk outside. You know, we live in a great community called Fort Wayne. Fort Wayne has so much to offer. And so making sure we take the time to go outside, enjoy the fresh air, it can make a huge improvement in your health.
And I have said too, and then we're going to let you give us a little bit more information. But if you walk 15 minutes away from your steps and 15 minutes back, you've gotten that 30-minute walk in.
Oh, yeah, absolutely. You know, every movement counts. When you're cleaning the house, when you're going to the grocery store, walking around the shopping center, every move counts.
Okay, and if you want to let us know here, Chris, how, if someone wants to get a hold of you, tell them again and how much you are available to them in the community. Go ahead and let them know that now.
Yeah, absolutely. The best way to reach me is through email, Christopher.Nicolai, Nicolai, at heart.org. And I encourage any community organization or anybody who is really wanting to make a difference when it comes to the public health and to strive for longer and healthier lives. I encourage you to reach out to me. Let's discover what's possible. Let's discover how we can build Fort Wayne into a heart safe, heart healthy community through your mission, through your organization, through what you have to offer to the community. And let's power together and empower lives to take a stand against heart disease and to build a healthier and stronger Fort Wayne together.
And I want to take this opportunity to thank you for coming on,
Thank
Chris,
you.
and sharing that information with us and letting the public know who you are and
Yeah.
what you stand for. I really appreciate you being here tonight and to say that if you need me for anything within your organization, you have my email. Go ahead and reach out. And we do a lot of things at ONV, so you may get called on again
Absolutely.
to come out and participate with us in this organization. And as we always say at ONV, when we're getting ready to close for the evening, always protect your mind.
Amen.